My name is Sarah Reineveld. I'm president of the Graduate and Professional Student Senate, and I'm here on behalf of GPSS, both to express my excitement about our first inaugural Science and Policy Summit, and also to express my gratitude to the planning that really made this event possible. To provide a little history, in 2007, as vice president, I worked to conceptualize with the then president and execute the first annual higher education summit that was really devoted to having a conversation about funding for higher education. Fast forward to 2011, and I'm honored that GPSS is sponsoring our first annual Science and Policy Summit, which will really facilitate a critical dialogue regarding research at the forefront of science and policy. The Science and Policy Summit could not be more timely or relevant, as it is truly focused not only on addressing the critical pressing issues that we find ourselves facing globally and also locally today, but because it is going to do so through a combination of innovative and interdisciplinary techniques. First, the summit, as you will see, will address some of the most global pressing challenges of our generation and grapple with how the research that we're doing, both as graduate students and as scholars at the University of Washington, is really going to better the people's lives, and here, both at our home state in Washington and abroad. At the University of Washington, Provost Lindstrom is actually leading a strategic planning exercise that students have been involved in. It's called the 2 Years to Do 2 Decades Initiative, and it's asking some questions, the purpose of which is to identify the needs and opportunities that the UW should be responding to, and also which of society's major issues should the UW be most focused on and solving in the coming years. The issues that this diverse group of stakeholders through the 2I, 2D process, including students, faculty, and community stakeholders identified as being the most pressing are really the issues that our panels are going to be focusing on here today. They are environmental sustainability and clean energy, followed by health and economic vitality. Second, in addition to really solving and grappling with these pressing scientific and policy issues, the summit's going to address the interdisciplinary dialogue between experts at the intersection of science and policy. Like many graduate students, I came to this university because it was not only a leader in my chosen discipline, but because it offered an opportunity to broaden my perspective through an interdisciplinary focus. As this 2008 graduate student of the Evans School of Public Affairs, I earned my interdisciplinary environmental management certificate here from the Program of the Environment, where I took a variety of courses on the intersection of policy and science, including courses on science and policy and law, etc. As a third-year law student focused on environmental policy, I was really able to use this background to co-found a journal really focused on environmental law and policy, the Washington Journal for Environmental Law and Policy. I raised my own experience here as a graduate student not because I think it is unique, but because I think it is actually the norm in an institution that's really on the cutting edge of policy and science. The UW truly understands that global leaders of tomorrow will have to grapple with these questions that include, for example, not only the science, how do we measure climate change, but also the policy. How does Washington State implement an alternative energy strategy here at home? Lastly, it is worth noting that while listening and interacting with a series of experts in the fields of policy, research, and science on our panels here today, there will also be an opportunity for you as graduate students to represent your research through a poster presentation and presentations after that. Through my involvement with GPSS, I'm really made aware each day of the amazing research and discoveries that go on here that graduate students make each day. I'm particularly hopeful that the Science and Policy Summit will provide an invaluable opportunity for you to interact with key policymakers in your chosen disciplines and to share your work with your peers and colleagues. So on behalf of GPSS, thank you so much for being here today and enjoy the summit.
So hello and welcome as well. My name is Allison Cullen and I'm the Associate Dean of Academic Affairs at the Evans School. And like Sarah, I have an interdisciplinary background. I was trained as a civil engineer and I worked at EPA, and then I went to grad school in public health, and I worked at a consulting firm, and I am now a professor at a policy school, the Evans School at the University of Washington. And so I think, as Sarah said, it's the norm. We come from many different fields and backgrounds, and especially in health and natural resources and environmental areas, we bring science and policy together in this way. So I welcome all of you to the University of Washington who are from outside. We have practitioners coming today and people from agencies and partners around town. And I especially welcome students because I think they're the heart and soul of what we do at the university, and I think it's wonderful that you're putting on this event, and I just celebrate that. I think it's terrific. There are a lot of challenges and future planning issues around especially energy, water, human health, transportation, lots of the issues that the panels will be grappling with. And none of these will be solved by any one field. And so as Sarah said, it's critical that we bring together people from many disciplines to work on these. And I think many people have understood for a long time that science needs to be able to inform policy. And if you look at the early days at EPA and other government agencies, there was this feeling that science and policy would be kept separate and science would be brought to policymakers and they would then use that in policymaking. But over time, and I was actually at EPA over a time when this was changing, there became an understanding that we needed this dialogue, we needed this interaction in order to bring policymakers and scientists together in an iterative discussion about what's needed, and policymakers also speaking to scientists and saying, look, these are the kinds of facts, these are the kinds of model runs, the kinds of information that would make a difference to us in what we're trying to do. So not just the scientists giving their information to the policymakers, but flowing in the other direction as well. The Evans School has a long history of collaboration among fields on campus and have been involved with the environmental management program, with the program on the environment. The program on climate change works with some of our students on a Gates Foundation project on crops and climate change and looking at how we can feed the world under future climate scenarios. We have faculty who teach multidisciplinary classes, and we bring in students from all over campus into our classes, and our students also go out and share in the other classes around campus too. And I think it's been a difficult time for the university, especially in recent years with the budget and looking at what we do and how that will be funded and how, who will get credit for certain things and who will put on certain courses. And so I just celebrate events like this for really standing up and saying, we need to keep doing this, especially in times like this, not just despite times like this. And as usual, I had a few notes, but of course I throw them away and then talk about whatever I feel like talking about. So I'm very fond of saying that although most people have a strong appreciation that policy has a lot of judgment in it, because of course an individual is having to bring together on behalf of a public decision many different perspectives, there's a lot of uncertainty, there are trade-offs, there are lots of things being weighed, and a particular decision-making individual or group is trying to weigh all of that on behalf of larger groups and make decisions on behalf of them. But science also has a lot of judgment in it, and I think scientists probably appreciate this in one sense, but policymakers appreciate it in another sense. And I would just stress that what we know about a scientific field, the fact that one result is published and another isn't, the fact that one project gets funded and another does not, the fact that we pursue certain lines of research at certain timeframes and others in other timeframes, all of that has a lot of judgment behind it. And so having that policy feedback about what would be relevant, what would help solve problems, can help shape those decisions that actually shape what science we end up with at our disposal, which I think is just super important, and it's very much a result of judgment. So that old tendency to think of science as much more objective and policymaking as much more subjective, I think we've seen that line blur quite a bit. So just to kind of give you a couple of things to think about today as you interact with people in your field, outside your field, in the university, outside the university, and from all over. I would say first, and students who've had my class have heard this before, but first, and I always try to put this first, try to become aware of why you believe what you believe about a particular issue, about a particular decision, about a particular challenge, about a particular scientific finding. And very, very importantly, what would change your mind? Is there some particular data or model result or finding that would make you rethink your current position or your current stance? And try to become aware of this on behalf of others too, as you talk to other people. What is it that's driving them to believe what they believe, and what might change their mind? And seeing where that common ground and that interaction can take place. Because you may find a fruitful new area for collaboration where there's something that both of you would find important and interesting. And so that is a really valuable thing that could come out of today for some people. Second, I would think really hard about communication. Sometimes between fields, we struggle really hard to find the words that will mean to others what we intend them to mean. And we misunderstand each other, sometimes hilariously, sometimes very badly. But like any relationship between disparate parties, you get out what you put in, and so it's really worth working on those communication areas, and you'll learn to speak multiple languages, and I think that's something that, for me, working across different fields has been really, really wonderful. And then finally, once again, I just really want to thank GPSS. I think it's amazing that you guys have put on this event, and I think it's so important at a time like this to stand up and say, if we're going to solve real-world problems, if we're going to address actual challenges into the future, we need to bring these fields together, and we need to be able to bring in people from inside and outside of universities, from every sector, public, private, nonprofit. All of those lines have blurred, and we can bring together people around problems and then become very issue-focused and problem-focused in what we do. And so I really salute you guys for putting this on. I think it's wonderful. And I thank all of you for coming, and I hope you have a wonderful day. And I know people will be coming and going all day, so I have a faculty meeting, so I won't be here for all of this. But welcome, and thank you so much for coming.
Good morning. I'm Charles Plummer. I'm an executive senator in the Graduate and Professional Student Senate, and I'm also one of the co-chairs who organized this event. So I just want to thank you all for being here, and I'm glad that even though it's early, we do have a few students in the house already. Before I say anything about science or policy, I want to take time to thank the countless people who made this event possible. First off, I want to thank my fellow committee members, specifically my fellow co-chairs, Megan Gams of Oceanography, Mark Jaffrey, the GPSS treasurer. Without them, this would not have been possible. The type of work it takes to plan an event of this nature, to execute it, is collaborative. So I want to extend my warmest thanks to the GPSS staff, senators, and officer corps for making this happen. Without them also, we wouldn't be here. I would like to also thank our contributors from across campus. To them, we give our deepest gratitude, and their financial support was critical in executing this event. The goal of this summit is to explore the intersections of science, scientific inquiry, and policy development, to showcase the broad expertise of the University of Washington's researchers, and to bring together students, faculty, staff, and fellow citizens to learn about and engage in some of the toughest issues facing Washington State today and in the future. The Graduate and Professional Student Senate is known for its advocacy on behalf of students, specifically on issues of higher education such as tuition, financial aid, and access. However, the students of the University of Washington have deep and diverse interests. And in many areas, we are actively producing the research and solutions to problems that directly impact our state. And with this in mind, GPSS has sought to engage our constituents in the broader university community in a new way that could leverage some of our unique talents and the critical role that we as a university play in producing data and studying these complex issues. The result is this summit. It is my hope that this event can be a tool to further connect the university to the state at large, as well as a place to begin the long and difficult task of tackling important and scientifically interesting policy problems. Sound science and strong policy are two of the cornerstones of our modern society. From the EPA to Silicon Valley, these two components have often been combined to our nation's betterment, but unfortunately, this is not always the case. Too often, we find obstacles standing in the way of translating scientific solutions into policy victories, be it poor communication, political gamemanship, or lack of funding. The results are often the same: bad policy founded on bad or incomplete science. It is with this in mind that GPSS has developed this event. And so today's summit will focus around four of the most challenging policy areas that stand for Washington State, the first of which will be public health. Clean water is critical for the health of our communities. Since the heyday of modern environmentalism, water quality and safety have been major concerns. Our first panel today will focus on the health of our drinking water. With that, I am privileged to introduce and hand over this session to our first moderator, Dr. Scott Minsky, from the Department of Environmental and Occupational Health Sciences and the University of Washington School of Public Health. With that, please welcome Scott and the rest of our panel. Either way, but we have a mic for you. So you can use this one or this one, whichever one you would like.
Good morning. Is this on? Okay, well, I take this opportunity again to welcome you this morning to our first panel discussion at this interface of science and policy. Go ahead and invite my panelists up to the podium, please. I'll waste no time here in introducing our panel this morning. Beginning with Professor Ginger Armbrust. She's a professor of oceanography here at the University of Washington. She's also the co-director of the University of Washington Pacific Northwest Center for Human Health and Ocean Studies. Two down from her, we have Dr. Catherine Daniels, an extension specialist from WSU, who is the pesticide coordinator and director of the Washington State Pesticide Management and Resource Service. In between them, we have Don Downing, who's clinical faculty at the University of Washington School of Pharmacy. And on the end, we have Mary Ann Guichard, Assistant Secretary for Environmental Health with the Washington Department of Health. We're very fortunate to have this diverse a panel. As the comments have already been made clear, these are very interdisciplinary topics, and they require an interdisciplinary, even transdisciplinary approach to adequately address them. I'm going to keep my own introductory comments very brief. Basically, what we're going to do is I'm going to turn it over to them, allow them 5 minutes or so to kind of introduce their own expertise and focus on the topics. And then I've got some prepared questions that the students prepared that we'll use to initiate the discussion. We'll carry that on for about 30 minutes or so, and then we'll open it up to questions from the audience. In the meantime, I'll keep it going as we go. So our focus this morning with this panel is on human health, public health, and its relationship or the impact of drinking water. And I'm going to open it even further into receiving water, surface waters as well, because I think that will facilitate a little more of the discussion, because some of the policy issues are really focused on that area. So without further ado, I'll turn it over to Ginger for an initial statement. Keep in mind, I will butt in if you guys start running over on me.
All right. Thanks, Scott. So first, let me introduce myself again. I'm Ginger Armbrust. I'm the director of the School of Oceanography, and I'm a professor there. I think can you hear me in the back?
No, I can hear you.
Okay, excellent. Thank you. And I have a research interest in the role of microbes in marine ecosystems. Okay. So first, let me start by thanking everybody for this forum. Thanks for having me here. It's really exciting, so thanks a lot, everyone. So first, I wanted to tell you about two things that I'm involved in that I think have relevance to our discussion today. And the first is that I am an appointed member of a federal advisory committee that is tasked with assessing national climate, okay? And this is something that is mandated by law, and it is directly with the interface between science and policy. And so just so you know that that's part of what my research applies to. The other thing that Scott mentioned is that I co-direct, along with Elaine Faustman from the School of Public Health, the Pacific Northwest Center for Human Health and Ocean Studies. Okay, if you can't remember that, just call it H2O. And this center was the result of the need to understand the impact of ocean processes on human health. And by ocean processes, we focus primarily on biological processes and how they impact human health. what our current focus is on the production of neurotoxins, believe it or not, by some marine microbes known as marine phytoplankton. There is a subset of these organisms that can produce a very potent neurotoxin. And this neurotoxin can be biomagnified through the food web, and that when consumed by vertebrates can be lethal, okay? The primary way that humans are exposed to this neurotoxin is through consumption of shellfish, okay? So, as I hope you all realize, your public health community, the Department of Public Health does a lot of work to make sure that our shellfish that we purchase is safe, that the shellfish that we go out and collect at different beaches is safe, okay? So, just to make sure that's very clear. And what our center is designed to do is to try and understand both the environmental drivers of toxin production by these different groups and the implications of those toxins on public health. We have research that spans across 6 departments. We work very closely with local, state, and federal agencies. We have relationships with different tribal nations, different cultural groups that have different consumption levels of these shellfish. So as Allison mentioned at the very start, it's been a really interesting interaction. You have to learn lots of different languages. I'm an oceanographer, and I had to learn how public health people speak. Public health people have to learn how oceanographers speak. It's been a really interesting interaction, and I've learned a lot from my public health colleagues to understand the implications of the kind of research that we do on policy and on public health. So I'll turn it over to our next speaker.
Catherine?
Good morning, everyone. I'll also echo thanks for the invitation to be on the panel, and I'll tell Scott that I might be his most difficult panelist because I tend to wander, so be firm with me in timelines. By way of background, I'll tell you that I have a PhD in genetics and cell biology, which really has very little to do with the field that I'm currently working in, except that I still find it fascinating. My field of expertise is in pesticide policy. I manage an office that focuses on information collection for the use and usage of pesticide as crop protection tools. Use refers to where, usage refers to how and why, and all the other details that go into making an application. Depending on the individual project that my office has taken on, I guess I should say I've been doing this for about 20 years now. So I've worn a number of different hats, and that includes being a liaison, a desk researcher, an advice giver to EPA. That's my favorite part because I like giving advice. A facilitator of USDA-funded workshops, and a grower-to-agency matchmaker. And in the spirit of being balanced, I should tell you the things that I don't do. I'm not a toxicologist. Since leaving graduate studies, I haven't been a bench researcher, and my work in water quality is strictly limited to how integrated pest management would further water quality goals. So Scott mentioned that I'm the director of the Washington State Pest Management Resource Service, and that means that instead of being an information center where I know everything there is to know, I'm a resource service that can take questions and guide people to those sources of information, those experts in the field. We cover a lot of different ground, everything from your average citizen calling me to find out what to do with black spot on their roses, to EPA calling and saying, we need information about what is the average size of a strawberry field in Washington. Do you grow wheat over an elevation of 5,000 feet? So there's a wide variety of questions that we get and information that we're asked to either collect and pass on from the grower level to a national agency, or to take the information that's going on at the national level and write it in a layman's language to get out to the growers or the public within Washington State, let them know what's going on in a level that they can understand. So that pretty much describes an extension agent's life. My job is to answer questions or direct folks to other resources. So I'm pleased to be on the panel. I'll be happy to answer all the questions that I can today. If I can't answer your question, then see me during break if you want me to actually get back to you with the answer so I can have your email address. Okay, thank you.
Great. Don?
Good morning. My name is Don Downing. I'm a clinical professor in the UW School of Pharmacy. And I guess I represent the people that make sure that humans get the products that foul our waters. So I have a different perspective somewhat. But I think my role today is to try to talk about the human needs that balance with our environmental needs. I have, well, let me give you an example of how this works sometimes for us. Several years ago, I was testifying in a Senate Healthcare Committee in Olympia on ways to diminish the environmental exposure to a number of drugs from the aspect of changing policy so that pharmacists could give on new prescriptions a small number of pills. A doctor will write a 100-day supply or a 30-day supply, but we know that significant numbers of people don't tolerate their medicines very well, and that they would end up taking 3 or 4 days of medicines, and then they have the rest of them available and on their shelf. And either they get dumped down the toilet, or a grandchild comes and takes them next time they come. I mean, there are all kinds of things that happen that are not very good. And I really thought that this sample drug program would be a good way to minimize impact, environmental impact. So I'm just getting ready to speak, and there's a commotion in the back of the room, and 140 senior citizens have been bussed into Olympia that day by PhRMA, the Pharmaceutical Research and Manufacturers Association, who make these drugs, and had them noisily come into the hearing room, and one of the senators on the healthcare committee said, "What's going on?" And right on cue, a little old person, geriatric patient, who sat up near the front said, "I don't want those pharmacists taking my drugs away from me." I don't think anybody heard anything I had to say the rest of my session. So I look a lot at incentives. Who's incentivized to manage the use of drugs and exposure of our environment to drugs, and who doesn't. We recently, in this session, had a bill that spoke to sharps that were being thrown away in the garbage, and waste management people had introduced a bill in our state to try to stop all the needle sticks that their workers were getting in the waste management centers. And they asked for ways to, provide containers that would take those things out of the environment. And you'd have thought that we were asking for, I don't know, the moon. The drug manufacturer said, "We're not going to supply those containers." The device maker said, "We're not going to supply those containers." The pharmacist said, we can't afford to supply those containers." So we have lots of policy and health and issues that you might not think that pharmacists might be involved in, but we're very much involved because we're right in the middle of that. And we can talk, or I'd be happy to take questions about drug take-back programs and such and the like if we have time to do that. Thank you.
Great. Let's finish up with Marianne.
Thank you very much. I, too, am really excited to be here. I am fortunate enough to be in a wonderful field called environmental public health, and we pretty much are at the intersection between science and policy. The division that I lead up is about 300 really talented staff that have come from a variety of different disciplines: health physicists, toxicologists, biologists, just a variety of different communication specialists, different disciplines. And our mission is to prevent human exposure to environmental contamination or hazards. And to do that, we have some both regulatory programs, but we also have outreach, assessment, and getting people the information they need to make healthy decisions. So we come very close in contact with all three programs you've already heard about. We certainly are involved in shellfish safety, as was pointed out. In fact, that was my first job at the state, and I still have a real love for that field, particularly as it relates to biotoxins, or these toxins that are caused by the harmful algal blooms that sometimes occur in Puget Sound on the coast. In that field, we have had in the State Department of Health a long history of monitoring for paralytic shellfish poisoning, one of our PSP, sometimes known as red tide, kind of a misnomer because it doesn't mean the water will be red at the time. But we found from historical times that this could be a very devastating neurotoxin that needed to be monitored for. So since even the 50s, we've had a program in place for that. But we're learning new things all the time, even though we have a lot of data and we've been, as I mentioned, doing this surveillance. We keep finding new things. For example, just recently we found out that there's an invasive species that's come into Puget Sound, in northern Puget Sound, and becoming quite abundant, called the purple varnish clam. People are recreationally harvesting this, and we found that the toxin is taken up differently by this clam and retained longer. So we've had to totally change our outreach program to the public as well as our commercial shellfish harvesters based on this information. Several decades ago, we discovered a toxin that was present on the coast called domoic acid that again was produced by harmful algal blooms, and we found that it was actually causing problems here in Washington, and we had to develop a regulatory program to deal with that. And again, policy and science really came to be because if you shut down any kind of industry, there's going to be huge economic impacts as well as cultural and recreational kinds of issues. So that is something that we struggle with. We have been in our drinking water program. It's one of our mission is to assure that there's safe and reliable drinking water for everybody in Washington. We have had concerns raised about pharmaceutical and personal care products that are being found in some circumstances. Fortunately, here in Western Washington, the majority of our population is served by cities that had the foresight to protect their watersheds, so we're not seeing that kind of levels that they've seen in other parts of the country. But even in other parts of the country, fortunately, the levels that are being found are so small that they're not an issue for public health at this time, but there's definitely an issue for ecological impacts. And again, that's a concern. One of our programs that we deal with is regulating reclaimed water. So certainly we want to make sure that the waste stream is going to be as pure as possible if that water is going to be reused for various purposes. So that's been an issue. We have investigators in one of our programs that go and investigate all pesticide illnesses to find out what were the cause, what could be steps that could be taken to prevent those kinds of exposures. And again, we have the intersection with agriculture and some of the stakeholders that you were talking about in terms of what are the impacts to public health if these pesticides get into our drinking water or our surface water. And so we have toxicologists, epidemiologists that look at those issues. So we pretty much have, like I said, the the gamut of responsibilities. In addition to some of the water quality issues that I mentioned, we also have staff that are out making sure that we're protected from unnecessary exposure to radiation. We have staff that are looking at food safety, looking at venues such as recreational swimming beaches or water slides, that they're safe, that our schools are safe for our children, and a whole host of things that really intersect between the environment and the public. And we want to make sure that is a healthy intersection. So that's, in a nutshell, what we do in environmental public health.
Great, great. As you can see, we have quite a range of expertise on this panel. And everybody has their own areas in which they feel most comfortable. I'm going to ask them to branch out a little bit and really focus on this issue or this intersection between science and policy in these next few questions. Let's begin the discussion with the questions put together by the students, beginning with what practices do you use to ensure that your research is accurately represented in the policy-making process, or, for those that aren't researchers, that the policies you are creating are based on the best available research? And with a follow-up, what are some ways that transfer of information from the academy to the legislative and executive could be improved? Anyone want to start?
Okay, I'll start. In the Department of Health, we do a little bit of research, but for the most part, we rely on academia and others to provide the research with us. But what we do is collaborate a lot with those researchers. For example, we're very much collaborative with the University of Washington in harmful algal blooms and providing data and information, as well as research questions that would be helpful for us at the policy level to answer. And we've consistently been recruiting and up until the budget issues, trying to get student interns in so that we can have that intersection again right in the policy level about what are the types of issues that we're facing, so the students can get that experience about really reality-based research and what would be the most useful for us. The problem we have is that sometimes we don't always know about what's going on, and we have like I said, toxicologists and others that do review the literature and try to bring us the most available science, but we don't always know it. And we don't always have the time to try to seek it out. So these kinds of forums like right now and others that the University of Washington has put together are really helpful for us to get the intersection going with the academia, and so that we can make sure that our decisions are the most based on the most research that we can possibly use. So I'll ask the researchers that same question.
Yeah, I have the experience that I've had most recently with this issue of being able to transition the science to the policy comes from this advisory committee that I mentioned at the start on climate assessment. And what we're trying to do there is use the available science to both relate the available science to Congress and also talk about the implications of that science on policy. So for all the students in the room, one of the best things you can do to impact policy is publish your research, right? Because as we start to evaluate this data, we have to go, the primary place that we look to is published, peer-reviewed scientific studies. So publish your data. It doesn't help just to have it, that you talk about it at a meeting, you actually have to have it published. So that's one thing that I would say to all the researchers. And then from the policy point of view, what I've seen in this climate assessment is that it's very important to have the dialogues between the two groups so that there's an understanding of what the science is, there's an understanding of the policy implications, and there's a recognition of what the two groups need to make the best use of that kind of information. So I echo what you said with the dialogue is really important, but I encourage you all to publish what you've been doing.
I'll step in. I'm rather a sidewalk level, I call myself, professor at the University of Washington. I mentor a lot of students doing research. I don't do a lot of research myself, interestingly enough. I usually raise awareness of issues and then use graduate students to do research for me. Interestingly enough, though, the research I'm involved in really is about making sure that people take all these chemicals that we put in the water rather than prevent them. That certainly is where the money is for research. And it does bring up the fact that we don't spend much time in the pharmacology world looking at the impact on the environment of the drugs that we work so hard to get people to take. Because we do have to pay attention to people's health and behaviors and the medications they take. And I would just say that we, well, right now I have a graduate student who's working on how people, in fact, dispose of their medications. And from a safety standpoint, looking at even lock boxes and such, but also how do we change society's awareness of the impact of throwing your leftover pills flushing them down the toilet, what sort of impact that has, and who are the best people in our health system that I work within who might best change those behaviors. Mind you, that I don't know that I fully appreciate the percentage of drugs that get into our waters from people flushing them down toilets versus eliminating them through peeing and pooping every day, the drugs. We have a lot of drugs that are injected or inserted and such, and they get the dose once, but we have IUDs with levonorgestrel in them, and those drugs are distributed in our bloodstreams and they're peed. We're not going to be able to manage that sort of distribution of the drug as long as we use those drugs. I'd be interested if any of our scientists here know what percentage of drugs are actually in our environment due to people throwing them away and potentially putting them in our water supply versus those that are naturally excreted into our water supply.
Well, I don't want to go too deeply into a project that I worked on, but to get to the question of how you might influence public policy and then how you might actually know that you influence public policy, I could tell you about an informational project I was involved in very briefly. EPA was doing review of active ingredients as part of the Food Quality Protection Act. There's a lot of information that goes into doing a pesticide review. And it's done in a stepwise fashion, and then part of the process is to put out a Federal Register notice and ask if there's public comment. The difficulty with that is that the reviews have already been done by the time you come to the public comment part. It's part of the public process, but it's not a very useful part of the public process. So there was quite the Donnybrook. At the higher administration, we're talking Vice President of the United States level, they finally got it worked out that EPA would actually come to USDA and ask them at a point in which it was useful. Gee, do you have some data that we can use? Because EPA is very good at processing data, but you simply can't have them out. I mean, there just aren't enough people where they could go out and find actual information. Models are used for good reasons because they're the most protective. But when you're talking about trying to refine uses, you need actual data. Are you actually using 100% of the product? Is it actually out there at 100% levels? Have there been weather degradation? Do people use less than you think they do? What's the actual data? You've put that into the process, and then you can get a better evaluation of the active ingredient at the end. So at that point, EPA had to ask people in USDA to come out to the states and ask us, what are growers doing? How are they using it? Is this product, in fact, critical to crop production? Or could they do without it? Could they use one spray instead of two? So we collected all that information. We're still collecting it. It's been a 10-year project. And as part of that, we've done evaluation. We go back and ask EPA about 6 months later, after we've given them information, was this information useful to you? And if so, how did you use it? So we got a direct feedback about the kind and quality and timing of the information, because I think it's really critical that you provide information at a point in time where it's useful and where it's important into the public dialogue. Part of things are raising questions when nobody's ever known that there's an issue, but on the other hand, when people are aware of an issue, putting in your data at the right time and to the right people is crucial. So to do that, you have to understand something about the regulatory system, if there already is one in place. So I guess my comment is, if you really want to be involved in the public process, learn something about the regulatory process to begin with, so you know where to insert your data, who to contact, how to go about that in your initial steps.
Okay, that's great. I've got a couple follow-up questions maybe on this one. The first is, we have many different levels of regulation of which science can inform, many levels of policy which science can inform. So how do those different levels impact, and how, even within the regulatory agencies, how do you balance the communications on science between the different levels of policy? Or maybe even between different regulatory groups, say Department of Ecology, Department of Health.
Let me take a stab at that. What I've found personally, and also through watching my colleagues in the College of Agriculture at WSU, is that we are often the one who convenes meetings. We're the hand holder who introduces two strange agencies to each other who've never worked together before on issues. We're also the ones that can bring the growers, or and to just use a more generic term, stakeholders, into the room. One of the points about science that we don't often teach our students is that you are usually, as an academic, the one that is trusted by all parties, because you're non-biased. So remember to be non-biased, okay? You have the credibility to bring people together and say, let's have a highly structured meeting where we can talk about what are the information needs for a particular issue. It's not where you get a group of advocates together and they're hollering at each other or politically posturing. You're actually taking an on-the-ground, practical approach. What is our issue broken down into steps? How can science help inform that? Do you have a model that's old and needs revision because science has moved forward on that? Do you have gaps in your data? Do you simply need people to be working by bringing in another collaborator, someone that maybe you haven't thought of before, to try to address an issue? And so the odd thing about this is you're trained as scientists. You're not trained as meeting facilitators, anger management specialists, matchmakers, but in the end, you may be doing those. Just like we don't teach you to actually write to speak to a layman's audience. We teach you to write to speak to a scientist, another fellow scientist. All of those are attributes that you can pick up in your schooling only if you personally are interested in them. But I think you'll come back to the point of having your specialization as science also brings with it a recognition by most people that you're a great person to work with, because you're not going to be beating somebody up about their political stance.
I really appreciate those comments, and I would like to emphasize for those of you in here that are scientists, I know not everyone here is a scientist, But as a scientist that was not trained in policy, it's been amazing to me that as a scientist I can have influence on policy. That you have that through your credentials as a scientist. It's early in my career, it was really amazing to me that I could have these policy implications, that I have started out with implications for science policy. So as you move through the ranks, you'll have different agencies come to you to get your input as a representative of your discipline about different directions that research should be moving, areas that should be fostered. And so that's a major impact that you're having on policy. As you continue moving through your career and show that you can do all the things that were noted earlier, that you can work well with others, that you can respect others' differences, different disciplines, different areas of expertise, that you can be called on more and more to have impacts at these higher levels. And then it can culminate where you're actually having an impact on policy that's larger than the science policy. So, you know, that's what has been part of my career that's always been a little bit of a surprise to me, that as a phytoplankton ecologist, I was having impacts on policy. So anyway, it's fun.
I just agree that you can have a huge impact even as a student on policy if you have the right timing, you're answering the right questions, and you're talking to the right people. And that's not always easy to figure out. But then another key to it is you have to be able to communicate to your audience in a way they can understand. And again, as was pointed out, that might not have been trained into you during your classwork, but you'll have to learn it if you're going to be effective. People don't like to hear acronyms that they're not familiar with, don't necessarily know scientific terminology, and so you have to be able to put what your research, what your answers into language that resonates with the policymakers and the general public. I had experience in my undergraduate work of doing a senior project that I was just trying to get the grade, and I thought I'd pick the easiest thing I could, and it had to do with fly larvae hatching in manure, because I had horses and I had lots of manure. So I had no idea that my work was going to have some value until my advisor said, "Oh, did you know that they're determining a ordinance, a local ordinance, associated with manure disposal?" And I brought my research, and they changed their ordinance just based on a student. It wasn't the most robust study, by the way. I wouldn't be embarrassed to present it, but it was information they didn't have. And based on the fact they had nothing, they took my study and turned it into policy. And that was my first experience, that you can have an incredible impact, but again, it's about getting it to the right people at the right time, not when they're ready to go ahead and sign on the dotted line, but much before that. And I also agree that public does trust, for the most part, researchers in academia because of the fact that you're not affiliated with a regulatory program or a certain advocacy. And I think that can bring the diverse stakeholders together, because what we've found is that in public health, and I think this applies to all the disciplines, we can't do it by ourselves. We have to bring in multi-disciplines, multi-stakeholders, and together solve some of these complex issues that we're trying to solve. And that requires facilitation skills, it requires good communication, and the willingness to listen and consider other perspectives. So those are all things that you can help us with, as well as be part of that whole process.
So this kind of, go ahead.
Yeah, let me make one more statement. I did say I don't personally do a lot of research, but I guess I'm involved in any time in about 8 research projects. I do a lot of work in reproductive health, which on one level is, provides hormones for, in our water supply. But on the other hand, in relating to what all of them have said, is that I think it was Bertrand Russell who said that passion without knowledge is a dangerous thing. And we have a lot of people who have a lot of passion without much knowledge. And I think it's important for all of you to understand that the knowledge that you bring to the public is critical to proper policy. And that the problem is that if we are an impassionate researcher and we can't bring our messages out to the public, then we haven't done nearly half our job. There's a lot of great information that gets trumped by passion out there. My example of the 140 people showing up in the hearing room was one that statements were being made by folks who had a lot of passion about not having their meds taken from them, but in fact that wasn't the intent, or I didn't think the outcome. But a lot of passion often trumps good science and policy, and reproductive health. I deal with it all the time in terms of people's cultural, family, religious beliefs. That, as in the opening remarks, he said, why do you feel the way, why do you believe what you believe? And I think it's real important that we address those things. And we have to be great communicators to do that.
So this brings up those last couple comments brings up a second follow-up question, which is or considering that policy or the initiation of policy is not always driven by science, and the timescales of science don't necessarily coincide with the time that we need to make policy. So how do you deal with the interaction between science and policy in those circumstances? And it's kind of directed towards the researchers, this question of certainty, and in terms of, we all have faith in the research that we're doing and our direction, but how do you communicate that with the appropriate level of uncertainty to inform policy?
Let me ask a question so I understand your question. Are you talking about us relaying a statistical level of certainty on what we know, or finding out from the public what their level of certainty is?
I think somewhat of both. I mean, in many cases, we're presenting our data, we're publishing our data, but data is always moving, evolving, changing. Science is changing direction as we find out more. So how do we inform a firm policy decision, which will become the law of the land, when we don't necessarily know everything that we would like to know to inform that policy?
Well, I think that everywhere from the practical to the theoretical level, if you wait until you know everything before you do anything, we'd still be little green algae cells. So that probably shows a hole in my PhD training, but we'll just skip that. We'll just skip that right now. The important point is, and it's like any other decision, when you're in the middle of trying to figure out what's your next step, you're here, it's now, you do the best you can. That's my practical extension side speaking. And as scientists, we're taught that we don't know everything and that we should always put a level of uncertainty, but don't let that level of uncertainty stop you from doing something. You just simply call it the best that you can at this point in time and figure that as it's a bootstrap process. As we learn more, we will do better. So I say to people, if you're unhappy with the levels of protection that you have now in whatever area it is, whether it's pesticides specifically or other areas of public health, then tell us what area of science you need more data in, and we'll go get it, and then we'll all work together to address it through public policy. But you have a choice of either saying that I'm going to follow the precautionary principle, which means don't ever do anything for fear that you don't know how it's going to work, or you just get down and dirty and say it's not going to be perfect, but we're going to try to do the best we can with what we know. And I think if you're honest with people and tell them that's the situation, they'll be very appreciative and say, okay, because a policymaker has to do something. Then, I mean, their jobs depend upon keeping society moving. So they're interested in coming up with a decision. even if it's, okay, we'll postpone the decision for 2 more years when a certain piece of critical data is going to be coming out. Or we'll revisit this in 2 years when more data will be coming out. So you can help people take what you've got today and also look ahead and say there'll be more information coming out at thus and such a time, and maybe we'll want to look at it again. But every model gets revised and changed as science goes forward, and that's the great part about science.
And I'd like to piggyback on that. I think that's the key, is to understand that policy is evolving, just like science is evolving. So as we learn more, we change the policy. And we make mistakes as policymakers because we have limited science. In public health, and particularly in our engineering field, we use best available science. That's what we have. And so we have to make decisions because no action is inaction. And that's hard for some people to understand when they first are starting off into public service field. They want to wait until they have a really good, solid scientific basis for a decision. But in that period of time, people are getting exposed, or industry is being overregulated, or whatever is happening at status quo, because the no action is a decision. An example I can give you is when I first started with the State Department of Health, shortly thereafter, I was managing the shellfish program, the Assuring Safe Shellfish that was discussed. And we discovered that we had domoic acid, which is caused by a phytoplankton as well, that we weren't familiar with, but we'd heard about in Canada because it was a big problem on Prince Edward Island. It had killed some seals in California and some pelicans, and we discovered it was in razor clams on the coast of Washington, but had no history of dealing with it whatsoever, and no action level at the federal level to deal with this. So based on very limited information, Centers for Disease Control specialist that was assigned to our agency and I did a very cursory epidemiological study and determined that there was apparently some mild health impacts associated with this toxin, but there is a really serious neurological consequence that occurred in Prince Edward Island we're very concerned about. So based on that really limited information, we shut down the razor clam and crab industry on Washington, which caused a lot of angry people, and some public meetings where I was fearful for my life. But that's the information we had. So what level could be established so that we could reopen these very important fisheries? And I asked our toxicologist at the time to please come up with the best answer that we could based on what limited information. And he struggled because he needed a lot of time to be able to put together enough information to publish. And I agree, we want information published, but I needed to know today because there were people's livelihood at stake. And so I had to struggle with him to say, just give me the best you can. He couldn't do it. And so we adopted the Canadian standard just because that's what we had. He later did the research and came up with the answer, what happened to be, fortunately, the same level as we adopted. And 3 years later, he came into my office and handed me the peer-reviewed article in a journal, say, look what time can get you. And I said, well, that's wonderful, but I needed it 3 years ago. And, again, it's just a better appreciation for the needs of the policymakers, also for the researcher. You need both, but you need to go with something, again, because no action is inaction.
Okay, well, let's move on to a second question from the students. What would you say the main barriers to ensuring policy is based on sound science, or the research is accurately reflected in that policy-making process? Ginger? I'm putting you on the spot.
Great, thanks, Scott. What's the main barrier? There's multiple barriers, but I think one that people in this room can help with is this issue that we've talked repeatedly about, is communication. Is making sure that there is dialogue that goes across both areas, and that there's an awareness of both areas. And there is an openness to different people's expertise, that there's science is not all, right? And being aware that there's other people that bring different levels of expertise to the question is really important. It's something that we can all work on, is enhancing our communication skills. I would like to believe that all of you in this room have worked very hard on your communication skills, regardless of whether it's in your classrooms, but that you're all very aware of the importance of that, of being able to talk about your data, your information in public settings, in the classroom, and in all sorts of different venues. So I think one of the biggest issues is communication.
I totally agree. You know, I'll go back to this opening statement again about why do you believe what you believe, and as a researcher, graduate student, you know, you believe because the science has led you to that belief, and but what's important in policy is that you understand why the people on the other side of the table believe what they believe. It's one thing to be brilliant and know everything about something, but when it comes to policy, you have to deal with people on the other side of the table who have a different set of beliefs. And it's important to go into the policy discussions with a firm understanding of where they're coming from. Without that, I'm sorry, you're going to be ineffective. And people will think, well, this is just some crazy scientist who has this belief, but you know what, it doesn't match mine, so you know what, I'm just going to disregard it. Disregarding of scientific facts, if you will, is pretty prevalent. Certainly in our society in the last 10 years has shown that disbelief of science and questioning what we think is pretty solid evidence has been a very powerful policy tool, including not only just disbelief, but demeaning and discrediting the scientific process that we're all involved in. So to me, it's just absolutely critical to know what's going on the other side of the table in their heads.
I think both of you have made great points, and I was thinking about those when I was invited to speak, and wondering what kind of things I would try to pick out of 20 years of experience. So I'm going to piggyback on what Ginger and Don both said by putting it at a lower level than saying, how can we change the way society perceives us, or how they'll receive our information. I would like each of you to think about how you will design your research projects or your overall program from the beginning to have an outreach component. This is not an afterthought. It's not a tag on, and it's not something that you can toss together and make a success of it. So I imagine you're thinking to yourself, oh my gosh, if I've got information, do I just sit around and wait for somebody to ask for it? It's a reactionary thing. Or how do I go bang on doors and get people to pay attention to what I'm doing? There's kind of a middle ground, and I would call that an outreach component to every project. And you sit down with the same kind of research mindset, and you develop a hypothesis, which is, how can I best educate my audience to achieve their goals? For this particular panel, the goal is scientifically based public policy. And you put that in to your research project. Doesn't matter if you're talking to NSF to get your money. Somehow or another, everyone still expects you to get your information out so that people can use it, whether it's the greater scientific community or not. So sure, they might be your main target, but what's wrong with having an outreach component at more of the Scientific American layman language where you have workshops, you sponsor summits, you do something in collaboration with other folks. Maybe you work at the scientific society level, where you have an ad hoc working group, where you might suggest topics for the yearly meetings, where you get together people where you can get a core group of people or a body of knowledge together that can inform. You're still going to have to read the newspapers. Here's one from the Tacoma Tribune on Monday, pesticide issue, a national crisis. So you've got things in your newspaper that tell you what society is worried about at the time. Design that into your research projects when you're first thinking about them.
I think all of those are just outstanding comments, and I really like the idea of the outreach, because one of the barriers we see at the policy level is we don't know about research that's going on necessarily, and we want to make decisions that are based on the best science that's available, but we need to know what that is. I think also something at the policy level that we don't do as good a job and we need to improve is outreach to the scientists and let you know what our research needs are and what our questions are that will make a difference in public health and environmental controls. And I don't think we do that enough. We do some things, example, coming to forums or collaborating with research, but we could do more about getting our research questions out there. And that's something that I'm going to take back to our staff as well, saying what can we do to do outreach as well.
So that's great. So I want to hurry and open it up to questions, but I do want to follow up on one last question that the students have posed regarding what sources they can use to stay up to date on, say, legislative debates in their particular fields of concern. A lot of us are good at following up and chasing down the science piece, or maybe some chasing down the policy piece, but how can you bridge that when you're not familiar with that piece of the field?
I think there's a number of venues that you can keep up to date on what's going on in the legislature. I'll tell you about the ones that I'm familiar with from my own discipline, so it won't apply to everyone. But for example, I get notices all the time from AAAS, from science, about various legislative policy implications. Within oceanography, there's the Ocean Leadership Group, which is a lobbying group that will tell you about different policy legislative events. I think that probably within all of your disciplines, if you talk to professors in your area, they can tell you about areas, websites that you can just get alerts on what's going on in the policy arena. So I think there's many areas that you can find out.
I tend to have this self-annoyance. I go ahead and subscribe to a number of feeds online. And I'll use Google search words that pop up, and so I have about 4 or 5 of those. I'm on listservs with policy folks. I work a lot with the Insurance Commissioner's Office. Man, I get all their press releases as they come out. So because those often deal with policy and health policy. So, we all hate all that noise on our computers. But I'll tell you, they just pop up. I get a chance to see them. I can get rid of them right away. For me, that's the way I do it.
I've done both of those things, and of course, with an information service, I'm supposed to have my fingers in many pies, and you're right, there's just too darn many emails that cross my desk. But I would encourage you to think about a particular area that you want to be in, and then go search out an opportunity to be on an advisory board. Whether it's for the agency itself, the Department of, this particular state has had some issues with advisory boards lately, but I'm assuming that students will populate many areas of the country and perhaps the globe. So look for opportunities to engage with advisory groups, whether there's something at the local level, like the county ag advisory boards. Attend workshops, look in places you would expect, like the Federal Register. They give you notices for open comment opportunities. You can look at the web page of the particular agency you're interested in. I follow the State Department of Agriculture page, but Department of Health also has a useful page. They put up information, and you can tell from that what their current concerns are. You can also hook yourself up to advocacy groups, not because you particularly believe in their policies, but because they're a very good source of telling you what's on their mind. So in pesticides, that might be the Washington Toxics Coalition, or the NRDC. It could be the Washington Friends of Farms and Forests. And lastly is to find some information network that you can plug into, whether it's through your discipline or through your professional society or just through the newspaper reading of the topic that you're interested in.
I think those are all real excellent ideas, and I would add that the Washington State Legislature has a very good website. You can go to that website and subscribe to find out about issues if you're interested in healthcare and the healthcare committees or the natural resource committees, and that can be a useful source of information. If you're interested in water quality, in Puget Sound in particular here, we have a very active program with the Puget Sound Partnership that is trying to clean up Puget Sound by 2020, and they have a science panel that is a liaison between the policymakers and the scientists, and they have research questions, and they're trying to work with researchers. If you're interested, I would encourage you to use them as a liaison.
Okay, great. So why don't we open it up to questions from the audience? I'd appreciate it if you would bring your questions to the microphones on either aisle, and please introduce yourself. I see some shuffling, but not a lot of movement. All right. Where do we go on this side?
Hi guys, my name's Andy Gregory, and I'm from the School of Marine Affairs. And the question I have for you guys is, people are doing research in areas and have maybe more or less public visibility, awareness within, whether it's the general public or policymakers who make decisions for the general public. And so my question is, a lot of times, even if the science is there and it's solid, and how do you find funding to implement the recommendations that either you're making as a scientist or that the policymakers are concerned with? So funding as a barrier to action on an issue that isn't necessarily in the public awareness.
That raises an interesting question as scientist, as advocate, in addition to just somebody who's nonpartisan.
I'll start off. I run into that all the time, and so I go out and search for funds from not necessarily advocacy groups, but foundations that support the issues that I feel strongly about. So I just find them all over the place. For instance, right now I'm working with the Summit Foundation in Washington, D.C. on a project. The Summit Foundation works with, actually, maybe not so ironically, with water quality of the Anacostia River that runs through Washington, D.C., which is really a problem that involves culture and a lot of issues. Policy for years, but they also are very, very supportive of reproductive health access. So I'm dealing with them on both of those areas, and they came to me, but they could have, but you can reach out to them, and sometimes these foundations are relatively small, and sometimes they like to remain fairly private and quiet. So you go to people who are being funded by them all the time, and I find that sometimes that works best. As an individual, you may have trouble getting funding, but if you can get yourself aligned with somebody who is routinely funded by these foundations that would support your work, then you become a very important asset for these people that have been getting funded but don't have the expertise that you have.
I'd like to just add one other thing with funding broadly, just in general getting funding. I think this harkens back to a lot of the things that we've been discussing today, and that is being able to convey your ideas clearly in a way that the people that are reading whatever proposal to whatever group, that they can read that easily, right? Don't make them work harder than they need to, and have the reasons behind what you want to do be up front and center of why I should care about this topic that's so important to you, but why should I care about it? So being able to convey those ideas to whatever funding for whatever kind of project is really critical. And that's something that I hope that you have the opportunities to work on in this phase of your career. Yeah.
And I agree with all those statements, but I'll also add you have to be meeting the goals of the group that you're getting the funding from, or that you hope to get it from. Now, their goals and your goals may not be the same. You may want to go a lot farther than they're interested in going, in which case you tell yourself this is a step-by-step thing. And it really, the human psychology, it works best to do it that way anyway. Major sudden change, we just don't, well, some of us anyway, just don't react to that very well. So I can give you an example from the world of pesticides. If you go into a grower community and you tell them that you want to get rid of all their pesticides, they'll stop listening to you. Yeah. But if you want to go in there and say, tell me the pests that are driving your pesticide use. Why are you using the pesticides? And then do we have enough data to help you design an alternative control mechanism? No? Okay, then let's go find some data. Let's go to USDA because that's who funds pest data. Okay? Maybe we'll go to SARE and get some money for doing a bigger system. You're the one who has to figure out how to solve somebody else's problem. So you may end up going to several different agencies to get funding, all revolving around the same issue. Your interest is in water quality, but their interest is in how do I stay in business? How do I get rid of the pests that are driving my pesticide use? Because believe me, if they don't have pests, they don't use the pesticide because that costs them money. They're businessmen at the bottom of everything. So what you have to do is look at a situation and find out what is a problem that your expertise can help them solve and at the same time meet your goals. So that may be things that you explain to them in great detail to begin with, and then on the other hand, maybe not. It's just a thing that you're helping them at the same time you're helping your own program. And alternatively, for those of you that have the kind of research that you can apply to NIH and NSF for basic research studies, I'm in the Department of Entomology, so I'll use them as an example. We have a number of folks that bring down very large NSF grants because they're studying the basic behavior or biology of an insect, because it gives some basic science information which can be spread across several realms. It just so happens that they're using a pest insect, which they can then turn around in their extension program and help the growers with. So look for opportunities where even if you're doing basic science, can that somehow help solve a problem somewhere? Can you help that particular group maybe make an incremental step? It's everybody's wish and dream that you can make world peace happen, right? But it's a huge, huge challenge. Like everything else, it's very complex. Let's just try it a step at a time and see how that goes.
Okay, why don't we have a second question?
I'm Sam from the Evans School and the School of Marine and Environmental Affairs. I thought Marianne had a story that pointed to an interesting question, and that's that even when there's a willingness for science and policy to collaborate, a lot of times they're not on the same time scale. And I'm wondering in what capacity you guys have dealt with this and what you found effective to deal with it.
Well, I think it's difficult, but again, I think it's recognizing it's evolving, and then the step process too, recognizing that we need to make small steps where we have the science to support us, and knowing that we may make mistakes and have to retract or go another direction. And again, the collaboration with the scientific community to get those missing gaps or the questions that we don't have, that information, so we can make better decisions. But as I mentioned in my story, you can't always wait. You have to make a determination. I think back to my first day in environmental public health. I was working for a county health department in California. And I went to where the elected officials were having their meeting. They're called the Board of Supervisors. And there was a young man giving his information on his demonstration project on fish habitat using some recycled tires. And he had a 45-minute talk with lots of charts and graphs, and he started off with methods and materials, just like he'd been taught. And 5 minutes in, he had no attention at all by elected officials. They were talking on the phone, walking in and out of the room. And at the end of his presentation, they went to decide whether to continue the project, and it was based on, I like fishing, so I'm going to vote yes. And the other went, well, that sounds like some money, and times are tight, so I'm going to vote no. And that was the dialogue. This poor researcher was crushed because none of his information was being used whatsoever in the discussion. Well, they did vote to go ahead and expand the project, but he looked like he had a serious defeat because his whole talk was totally ignored because he didn't communicate it well. He didn't say, again, up front, why should I care? What is my findings? And then get to the more detail. So I think that's something, again, communication and being sure that you're answering the questions people want to hear.
I'd like to chime in on this too. From a healthcare provider standpoint, certainly as a pharmacist, I'm asked all the time whether a drug could be used for a certain purpose or not. And by the way, the patient is here and is dying, can we use it? And we don't always have the facts. And so the first thing I think of, first of all, do no harm. And then second of all, what do we know that we can use that might reduce the risk, even if it's not perfect? A lot of people will come to me and they want me to give them a firm answer. And certainly the worst thing we could do is to give them something we don't know enough about to respond to. If we put ourselves out there as an expert, and frankly by having the credentials that you all have from the University of Washington, you're expected to be an expert. But what happens is we sometimes get somewhat sophomoric and we think, you know what, I am an expert. And I am going to give them the answers they're looking for, and there's no greater route to destruction than to provide that answer. So we have to know who we are and what our strengths are and not go beyond them.
Can I add just one other thing? Because we keep talking about communication and outreach and all of that, but I do want to emphasize that probably most of you have either had or will have an opportunity as a teaching assistant in the classroom. And I just want to make sure you realize that talking to these undergraduates in your classroom is great training for talking to public, because the undergraduates in your classroom are smart, but they don't know as much of the details about a particular topic as you do. And what you're trying to do is communicate these complicated things that you know to someone that's perfectly capable but doesn't have the same skill set, the developed skill set that you have. And so being able to communicate in the classroom, I think, if you can do that, you can talk to many different groups outside of the scientific or your specific discipline. So I'd like you just to recognize that you have different venues to enhance these skill sets.
So I'll just make one last comment here about different tactics that I've used when an agency needs to make a decision right away and we don't have data. There's something called the scientific wild ass guess, which we laugh about among ourselves, but really we have usually some basis for making that. If we haven't heard of a particular insect, but it belongs to a particular class and we know how the other class acts, then we say it's likely to do X behavior. Okay, same in your other areas. What you come up with as a discipline expert is going to be better than what the average person can pull out of their ear, okay? So that's not necessarily what we're going to like to make public policy on, but it's a start, okay? So if you have absolutely nothing, as terms of published data or anything else, you go with that. And you tell the agency, I'll find the data. I'll put a call out among my discipline experts. I'll do something to see what we can get back to you in a week. And then if you have some money, some seed money, even something like $10,000 or $20,000, we can do a really quick and dirty study. There was an issue where, public health issue, a pesticide which has been, I won't say banned, but really that's the wrong term, but we'll just use that for an easy term. Many, many years ago, it's herbicide Dynaseb. It was found in Grandview a number of years ago, talking about the chemical itself has a yellow coloration. When you pick up the dirt and spit on it, it's all yellow. That's the concentration that was found. We're talking about a serious issue for drinking water. The agency came to the Food and Environmental Quality Lab, an analytical chemistry lab, and said, we need a really quick way of doing some water testing because we've just basically shut down every water well in Grandview. And the chemist said, well, the normal test will take about 2 weeks to come to the final resolution, is it safe or not? And the agency said, we can't do that. We can't shut down water wells for 2 weeks. So she thought about it, talked to her colleagues, worked on something, and came up with a test that could, a quick and dirty test. Not the kind that you publish in scientific journals, but a quick and dirty test that in 3 days could give them the results. It met the need at the time. So what you do is kind of a bartering. You tell the agency what you can do, what you can come up with from your colleagues, what little bit of money can go a long way. And then maybe later on, if it's a bigger, longer-term study, you can go to a federal agency and get some funding for it. But oftentimes, the political part is, I got to deal with it now. So figure out how to help them do the best that can be done under the situation, because they're okay with standing up on the microphone and telling the public we're doing the best we can, because you've told them it's the best that can be done. It's better than saying they don't know and they don't know what to do.
We have another question.
Thank you. My name is Richard Ellison. I'm actually an adjunct at North Seattle Community College. My question relates to the difficulties of changing public policy and the ideas that many policy decisions are driven by economics outside of science. And the role, essentially, what is the role, or how can we advocate better? Because if you have all this money being spent from the sort of manufacturing end of pesticides, advocating for the use, it seems to me that it's the general public that is the real driver here on getting a politician to make a decision either for or against something that's pro or against the environment. I mean, if you have a lot of herbicides coming off of lawns going into the Puget Sound, it's very difficult to get Home Depot to not have stacks of it in their facilities. So it seems to me we could try to lobby the legislature, but the legislature is afraid of doing things. So it seems that we need to lobby the public. And how would you perceive things need to change in order to get students and faculty to essentially be a little bit more aggressive and maybe be trained, maybe have classes in public speaking to deal with these kinds of forums and situations, so that we can actually see change happen a little faster, because I think that perhaps the environmental needs require a greater speed.
Well, since you mentioned the P word, I'll go ahead and take that question first. It's a complex topic, and I often tell people that it's about on the level of nuclear energy in terms of the complexity of the regulation, the complexity of the information process that you have to become familiar with. in order to not put your foot in any cow pies. And it also generates the same kind of emotional levels of response, pesticides and nuclear energy. So the first thing is to know that you hardly ever find anybody who's sitting on the fence. They're either for or against. So the best thing I can say is that science informs many of our decisions, but it's not a trump card on any aspect. Pesticides is just an example. We don't live our lives according to just science. As humans, that may be a failing, but nonetheless, that's the way we are. So there's a lot of different aspects that people bring to their quality of life decisions, whether it's their own personal one or the world as a whole. So I'm going to flip this around and say, when you're thinking about a small farmer, maybe an organic farmer, the first things that pop to your mind are sustainability. And the three legs of sustainability have to do with economics and also the environment. And I forget what the third one is because I'm not in that area. But anyway, there you go. There's no difference between that and looking at a commercial grower. They still have to make money. They still grow your food. So again, how do we come up with solutions that get them stepwise from where they are now to where we would like them to be? So it's not going to really do any good to exert more political pressure in the sense of hollering. It's not going to help agencies make their decisions any easier by going and telling them you have plenty of scientific data. Because what you really need to do is have targeted data. Right now, people hear about pesticide contamination and runoff, and the general story is across the country, not specifically here in Washington. Or you may hear about one watershed that's having an issue at a particular time. So let me tell you a story about the Washington State Department of Agriculture. A couple of years before the whole ESA thing happened, Jim Jesernig was the head, and he said, I see this big train wreck coming, and I want to start collecting data, water quality data, to see what are the levels of pesticides in the water. So we got some funding, and the industry just had a fit. They said, you're out to put us in the crosshairs. So they insisted on having a separate advisory board from the board that the department normally has. And people there wanted to be in on every single decision. And so the department said, okay, fine, we'll do that. You come, we'll tell you everything that's going on. We have toxicologists, we're going to be collecting water, we're going to be doing samples for 87 different pesticides. And they picked the Yakima Creek watershed and also the Thornton Creek, because that one is got some restoration going for salmon, but it's a completely urban site. So they started this in, let me check my facts before I go off. I think it was 2003. They started the study. Hang on a second here, or I'm going to wander off my topic. Okay, started the study in 2003, and at that time it was a 3-year project. They sampled for 87 pesticides as well as some of the legacy compounds like DDT, which of course aren't registered. And in Thornton, they also tested for semi-volatile organic compounds. And what they found was 96% of their samples had no detects. In one time, they had an over the water quality limit. They continued for another 3 years, similar situation. All of a sudden, the growers said, hey, this is a terrific success story. We're going to go to the legislature and lobby to have more money put into this, and could you please come up to the Skagit watershed and test that? And the next year, could you come to the Wenatchee and Entiat watershed and test that? And every time they hear about an over limit detection, they turn to the compliance people and say, you are going to go after that grower, aren't you? So what happens here is that Washington State Department of Agriculture has collaboratively been collecting data since 2003. They turn around to give it to EPA and to NOAA. NOAA won't use it in their biops. So we have a problem. We have a public policy problem. The idea being that if you can show that you're using something responsibly, why couldn't you continue using it? If you can't use it responsibly, then the growers are going to be the ones that say, okay, we're not using it responsibly. So it's understood if somebody comes in and regulates us. So what I'm saying is that I think to paint things with a broad brush makes it difficult for public policy. But if you can come in and say, let's do some sampling, find out the extent of the study, show that people are either doing what they're supposed to or not, give them chances to do it right, help them with educational programs, and if that doesn't work, then put regulatory penalties in there. So that, I think, is more moderate, more middle of the road, and probably stands a better chance of success in the long run. But that's my personal opinion about how to get success. We also have folks that prefer the legal suing end of things, and there is a place for that when agencies refuse to do what they're mandated to do. So I'm probably gone way over time.
Okay. Well, we have come to the end of our time, but I do want to give 1 minute to each of you for a final comment, but I'm going to direct you a little bit. A lot of what we've talked about has been with the science piece being responsive to a particular policy need. Our science needs to inform policy. How can scientists step forward and really set that agenda at the early research level, kind of set some of the questions rather than just responding all the time to what the public puts forth in the policy?
Start at that end.
Well, I'll go ahead and start. In the graduate students that I work with every day, we have decided to introduce public policy and advocacy in the first introduction to graduate school, so that they understand that they're not just people who know facts and study facts, but they are folks who need to be involved in the community. And so we actually send 60 to 80 students every year down to Olympia to be engaged in the policy part of things before they even know what they're talking about, just to understand what it's going to take to be a really effective researcher. And so that's what we do. We just try to condition them to be the communicator and the wise investigator right up front.
Yeah, I'd tell a little story in regards to this. There was a presidential election a while ago, not the most recent one, a while ago, that the results of the election had various students in my department upset with the results, right? There's always a winner and a loser. And the students were upset, and their response to that was that they had to increase their outreach. They had to do more work in the high schools. They had to do more to help increase scientific literacy. And I was really impressed with that kind of response. I'm not sure it's the only response, but I thought it was a very interesting response of helping others to understand the importance of science and how it impacts our daily lives. So.
Marianne?
Well, I think we've covered a lot of this in that scientists to be aware of how the political system works and how you can be effective, to be knowledgeable about what issues the public cares about, and then determine maybe what kinds of questions need to be answered, to interface with the government agencies on various levels and at various times, and then to be a really good communicator so that you can be effective and you can set the agenda. Because a knowledgeable person can be so influential, because most people are afraid to get involved into the political process, and so you just have the squeaky wheels out there. There are people that have an agenda. To have somebody come forward with unbiased scientific information in a straightforward manner can be extremely influential.
I'll go back to my earlier suggestion about getting on advisory boards for agencies, because at the very practical level, they ask you at the end of every meeting, what do you want to talk about at the next meeting? So when you're saying set the agenda, Marianne, that's exactly what you're doing, is you say there's a topic I think that's on the horizon that we need to talk about, position, because what you need to do is help the agency be positioned in a place where they can respond when an issue happens. And the only way they can do that is if they know there's a potential issue out there. So it's your responsibility, actually, to bring it up to them. Let's talk about this in advance before it becomes a crisis. Let me tell you what I hear among my discipline colleagues, what we had a symposium about at the last national meeting. There's something you need to be aware of.
Great. So thank you, panel members, and thank you for putting up with us going over time a little bit.